I was getting stomach cramps. I was going to the bathroom more often, but I didn't understand what was going on.
My foot fell asleep, which was strange because I was actually running at the time. And it never woke back up. And then over the next couple of weeks, the numbness that started on my foot slowly spread up both of my legs.
Sports were everything for me. Anger, emotions, competing, they were an outlet. All I wanted to do was to be a good athlete, get a scholarship, and go to college. During lunchtime, I ran to the bathroom and then there was blood, like a lot of blood in the toilet, and that's when I was like, something's going on. I left school and then I ended up in the hospital for like 4 days. They ran a lot of tests. They did like scans of my intestinal tract. They did an endoscopy, a colonoscopy, and then pretty much what they found out is that I have ulcerative colitis. It's an autoimmune disease where your immune system attacks your colon and causes ulcers and inflammation.
I had everything planned out. I think since the age of 3, when every Halloween I put on a white coat and a stethoscope and I would carry around my little doctor bag. I always knew that I wanted to go into medicine. I was enrolled in the CRNA program at Rutgers. So I was in graduate school to become a nurse anesthetist, which is someone who gives anesthesia in the operating room. It's a really competitive graduate program that only accepts about 20 people per year, and I had worked as an intensive care nurse in Georgetown, and neurosurgery was my specialty, trying to earn my spot. And then that very first day in the operating room at UMDNJ, I went to put on my surgical scrubs and I was tying the drawstring of my pants and I realized that I had no feeling from the waist down. I ended up being taken to the ER and ultimately diagnosed with MS. Multiple sclerosis is an autoimmune disease that attacks your brain and your spinal cord. Damaging nerves can cause a huge variety of problems, which can range from difficulty with walking and moving your muscles to issues with thinking and cognition.
I hid it from everyone. Everyone. My teachers, my best friends, my girlfriend, even my parents at times when I could. Like I never wanted people to see me in a vulnerable state. It wasn't the vision I had for myself.
I certainly worry about it. Looking for a job, for instance, I didn't know, is this something I talk about? Is it something I don't talk about? A lot of people struggle with whether to disclose it to their employers and their coworkers because they don't want to be looked at as being inferior or less capable.
I would flare up every fall and every spring. There's times where you go, nothing comes out, your stool changes, there's blood, there's severe cramps in your abdominal region, weight loss. You don't want to eat because you don't want to use the bathroom. At my worst, I used the bathroom 27 times in one day.
Relapses in multiple sclerosis are any time that the body is attacking a new area of either your brain or your spinal cord. So the tricky part about it is you never know where it's going to choose to crop up and where it's going to choose to attack. I woke up one morning and I couldn't flex the muscles in my right leg. So I knew something was going on, and then over the course of the next few days, I could no longer pick my foot up and I could no longer walk. And that's the first time that I actually ended up having to use a cane and be in a wheelchair.
I ended up getting recruited. It was Worcester Academy in Worcester, Massachusetts. I played football there, but that November break, so just like a normal college, I came home for November break and I got another flare up. Ended up in the hospital, and this one was different. It was bad. It was just each flare up was worse and worse, It was more of a setback, it was more weight, it was more pain, it was everything, and I didn't go back for the spring. And then that's when I set up a consultation with my surgeon.
The doctor that diagnosed me with MS actually sat me down and said, "This isn't realistic. You need to rethink your whole life plan. Your career goals aren't going to happen. You have very advanced disease in your spinal cord." And I kind of didn't accept that. I thought that was terrible advice. So I kept going. I didn't take a break from school. I didn't stop for the semester even. And I realized that I could have a big impact on the community if I could treat patients, but also know what it was that they were going through. Just thinking about it made me excited.
That spring is when I ended up getting the surgery.
Surgery for ulcerative colitis is a surgery where the entire colon is taken out, because the entire colon is what's involved and what could potentially become inflamed. So no segment of the colon should really be left, because any segment of the colon could potentially become inflamed in the future. And then there's a connection that's made between the small intestine and the anus. So the anus is they're connected by creating what's called a pouch, or a J pouch, which mimics or creates a reservoir for stool, which is similar to the rectum. It tries to act like a rectum normally would, holding the stool before it's expelled.
Right after, I felt great. I felt awesome. I ended up putting like 10 pounds on in the first 6 weeks. But something went wrong. I didn't know what went wrong at that point, but I struggled for the next 5 months. It was actually the worst 5 months of my life.
I was 25 years old at the time, and MS does not shorten your life expectancy. It can take away some of the quality of your life, but it really doesn't take away any years. And I realized that it would be kind of nice to have a little extra word of encouragement on a day that I wasn't feeling good. So it's aptly named A Letter to Myself on a Bad Day. For me right now, it's a good day. But for you, it's a crashing on the rocks kind of a day. And I know that you're worried that this is the relapse that you won't be able to recover from. And that's totally valid. The only words of advice that I could possibly offer would be to relax and wait and see what happens. Use it to connect with others, to teach, to raise awareness. Great empowerment can come from times of weakness. Never forget that I love you. You'll be okay again. When you feel like you're ready to, start rebuilding, brick by brick.
As a 22-year-old kid, I've dealt with more than people do in a life. I've suffered more than people do in a lifetime. And every time I was at that point, I'd question things. What's the meaning of life? What's my purpose? What's my destiny? What's success? What is anything, When you're laying in a hospital bed staring at the ceiling and all you have is the people that are around you, your girlfriend holding your hand, your best friend, your family, and the relationships you built in this life is all that matters.